How do you prevent and treat common respiratory infections in kittens? Kittens are adorable and playful creatures that bring joy to our lives. However, just like humans, they are susceptible to respiratory infections. These infections can cause discomfort and even lead to serious health complications if left untreated. In this article, we will discuss preventive measures and treatments for common respiratory infections in kittens, helping you ensure the well-being of your fluffy friends. Understanding common respiratory infections. Respiratory infections in kittens are often caused by viruses, bacteria, or other pathogens. The most common respiratory infections in kittens include 1. Feline Herpesvirus, FHV1. FHV1 is highly contagious and affects a large number of kittens worldwide. Common symptoms include sneezing, coughing, nasal discharge, fever, and loss of appetite. 2. Feline Calicivirus, FCV. Similar to FHV1, FCV is highly contagious and causes symptoms such as sneezing, nasal discharge, mouth sores, fever, and in severe cases, limping or difficulty walking. Prevention. Preventing respiratory infections in kittens is crucial in maintaining their overall health. Here are some preventive measures you can take. 1. Vaccination. Ensure that your kittens receive their vaccinations on time. Regular vaccination protocols include a combination vaccine that protects against FHV1, FCV, and other common infections. 2. Hygiene. Maintain proper hygiene by regularly cleaning your kitten's litter box, bedding, and toys. This helps to minimize the exposure to pathogens. 3. Isolation. If you have a new kitten or suspect that one of your kittens has a respiratory infection, isolate them from other cats in your household to prevent the spread of the infection. For limiting exposure. Avoid taking your kittens to crowded places such as pet stores or shelters where they can come into contact with infected animals. Treatment. If your kitten develops a respiratory infection, prompt treatment is essential to ensure a quick recovery. Here are some treatment options. 1. Veterinary examination. Take your kitten to a veterinarian for a thorough examination. A professional can accurately diagnose the infection and suggest the appropriate treatment plan. 2. Medication. Based on the diagnosis, your veterinarian may prescribe antiviral, antibiotic, or anti-inflammatory medications to treat the infection and alleviate symptoms. 3. Supportive care. Ensure your kitten gets plenty of rest and provide a warm, quiet, and comfortable environment. Offer them plenty of clean water and nutrient-rich food to boost their immune system. 4. Humidifier. Using a humidifier in the room where your kitten spends most of its time can help soothe the respiratory tract and facilitate easier breathing. Preventing and treating common respiratory infections in kittens is essential for their well-being. By following preventive measures such as vaccinations, maintaining hygiene, and limiting exposure, you can significantly reduce the risk of your kitten developing respiratory infections. If your kitten does become infected, prompt veterinary care, medication, supportive care, and the use of a humidifier can help ensure a speedy recovery. Remember, the health of your fluffy friend should always be a priority.